Hello everyone, I'm Dr.Rajeshwari Rapata speaking on Sai Sanjeevani Homeopathic Clinic on the Instagram page. Today's topic about children's ailment, that is respiratory tract infections. So the most common respiratory tract infections which happen in children are the upper respiratory tract infection. What is this upper respiratory tract infections? So any infections in the throat or in the main airway, that is the trachea, or the airways connecting into the lungs, are collectively called as the upper respiratory tract infections. There is another one called as the lower respiratory tract infections also, but that becomes more serious. So the most common ones which occur in children are the upper respiratory tract infections, and these infections are to be taken care of immediately, and mostly children suffer from this recurrently. It's also called as children's bronchitis. It is also, the children also suffer frequently, and then that becomes a great problem. So most URTIs are due to viral infections, and these infections you'll find that they are self-limiting, but still they have to be treated to avoid further complications. There are homeopathic medicines which we give for these upper respiratory tract infections. Hello, Prachi, there watching me. Do stay with me, and if you have any doubts you can just put it in the comments, and I would like the audience to tell me what further topics you need to be discussed here on Instagram, and I'll be there in the future with those topics. So today we are going to discuss about some homeopathic medicines which we give for the upper respiratory tract infections. One medicine that is called as antim-tart, which is given in right from 6 potency to 30 potency in children. And here in this antim-tart we find that the children, they have the noisy rattling cough, and there is no expectoration, but the cough is stuck inside the chest, and the movement of that cough expectoration inside causes this noisy rattling type of noise, and any movement will increase the cough, and there is difficulty in breathing, and tongue is coated thick white. So that is the main indication here. Along with all these complaints, you will find that there is thirstlessness. Even there is the tongue is coated white and thick, still there is thirstlessness, and vomiting is associated with all the other complaints. So that is the indications which we give the antim-tart. Another medicine is Bryonia alba. Especially in this winter season, we find many patients which need bryonia. So there is dry spasmodic cough. There is very little or absolutely no expectoration, and it is aggravated by its slightest movement. So every movement will cause the cough to be aggravated, and the child lies still because of the aggravation by movement. That's a chief characteristic here. Along with this cough, there will be also constipation, and here the child craves for more water. So he is very thirsty and drinks large quantities of water. And absolutely these are seen in the patient. It's not just in the textbooks, but it's the prime indication here of the Bryonia 30. There is fever associated with the cough, dry cough. There will be constipation, there will be dry tongue, so dryness everywhere in the mucus, anywhere in the mucous membranes. This is the prime indication here, and that's when we give bryonia. Another medicine is ferrum phos. Ferrum phos, right from 6 potency to 30 potency, depending on the indications we give the medicine, and it is usually indicated in dry spasmodic cough, but here there is a continuous fever. So this expectoration is sometimes streaked with blood also. So fever is always present and there is a very rapid and weak pulse. That's when we give ferrum phos. So inflammatory stages, in the early stage when associated with fever, ferrum phos can be given. Another medicine, that is ipecac in 6 potency to 30 potency. We usually give this when the cough, there will be lots of expectoration and there is nausea and vomiting. Whenever the child tries to cough, along with that there's a lot of expectoration and vomiting, and the child feels nauseating, won't eat anything, and then there is a retching along with the vomiting sensation. There is a rattling of the cough inside the chest, similar to that of entim tart, you can say. But in entim tart there is no expectoration, but in ipecac you will find there is expectoration. The tongue will be clean, not as such in the entim tart where there is a thick coated tongue. So tongue will be clean in the ipecac, and the child is thirstless. Then we give the ipecac. These medicines work so beautifully and you will find there is a result within a short time. There is another medicine, that is Sambucus nigra. In Sambucus nigra there is the dry cough of the infants, and the nose is dry and the child is suffocated. In the midnight you will find the child wakes up with lot of sweating, perspiration, and there is a suffocation, the nose is blocked, and there is the cough also present, the expectoration is present in the chest. This is dry coryza, and here the Sambucus is indicated. And when you give Sambucus, you will find instantly, until the morning, you will find the child is okay with no suffocation and breathes well. So this suffocation is associated with the inhalation being more problematic than the exhalation. So the child is unable to inhale and Sambucus works well. Another medicine which we give is Spongia tosta in 30 potency, and that's a dry barking type of cough. So when the cough comes out, you will find that it's not rattling, it's not like so much of expectoration coming on, but it is dry and barking type. All the complaints here are aggravated by cold drinks, even the cold air. Also with the head, if the child lies with the head low, the cough aggravates. The dry cold winds also aggravate the cough. But the child is better by feeding, by eating and drinking warm things, warm water, warm food. So that's where we give Spongia. So these are some of the medicines for respiratory tract infections, you can say. But there are still more medicines which we give depending on the constitution, depending on the peculiar symptoms which we find. And these medicines are only, what I am explaining here is only for educational purpose. So people come to know that these are the medicines which are used in homeopathy for the upper respiratory tract infections. Self-prescription, just avoid, and don't take these medicines over the counter. Do consult a homeopathic physician, homeopathic doctor, and if you want to consult me, you can go to the website and book an appointment there. Also, if you like my videos, do join me on YouTube and subscribe to my YouTube channel. Do follow me there. And this is all for today. And if you want many other videos, or if you want me to talk on different other topics, do mention in the comments and let me know, so that I'll be preparing for other topics to be discussed on Instagram. So this is Dr. Rajeshwari Rapata signing off for today. See you tomorrow again. Bye.